Have you ever thought about an invisible issue that could be affecting men all around us? A silent troublemaker who is simply waiting around and silently affects millions of people without saying a single word. Yes, you are right. We're talking about prostate cancer. It's like hidden puzzle piece in the big picture of health. Understanding prostate cancer isn't just important for men who's dealing with it, but it is also important for their loved ones. Knowing about prostate cancer can help you support your dad, brother, husband, or friend better if they ever face it. That's why we're here today to give you the information on prostate cancer. We've split this video into 3 parts for easy understanding. In part 1, we'll discuss what exactly prostate cancer is, along with its basic characteristics, risk factors, and symptoms. Then, in part 2, we'll move on to how doctors diagnose it, the screening process, and the various treatment options available. Finally, in part 3, we'll wrap things up by discussing how to prevent prostate cancer, offering some lifestyle tips, and tying it together with a neat conclusion. So, whether you're a guy or just someone who cares about the males in your life, stick around because we're going to break it all down in a way that's easy to understand. Let's get started. Prostate function. The prostate is like a little buddy nestled inside a male body. It's a small, walnut-sized gland that sits right below the bladder and in front of the rectum. Now, this little guy has a big job in the male body. Its main function is making fluid that behaves with sperm to create semen, which helps carry sperm during ejaculation. The prostate as the behind-the-scenes hero in the male reproductive system, quietly doing its thing to keep things running smoothly. Now let's talk about what is prostate cancer and its basic characteristics. Prostate cancer happens when some cells in the prostate gland start misbehaving. Instead of growing and dividing in an orderly way, they start growing too much and form a lump or tumor. This can lead to issues as it may press against nearby organs and potentially spread to other areas of the body if not detected early. So, in basic terms, prostate cancer is when the prostate gland gets some bad cells that grow out of control and cause trouble. Prostate cancer is one of the most common types of cancer in men, especially as they get older. In fact, millions of guys around the world are diagnosed with it every year. Now, while it's often slow-growing and may not cause any trouble for years, it can still be a serious health concern if not caught early. Catching it early can make all the difference. The earlier you catch it, the better the chances of treating it successfully. That's why understanding prostate cancer and being aware of its signs and risks is most important for every guy. It's all about keeping your health in check and taking care of yourself. Now let's talk about its risk factors. There are some things that can increase a guy's chances of getting prostate cancer. Number 1. Age. Prostate cancer is more common in older men. As males get older, their risk goes up, especially those over the age of 50. Number 2. Family history. Family history is another significant factor. If someone in your family has had prostate cancer, your risk goes up too. Number 3. Ethnicity. African American and Caribbean descent men face a heightened risk compared to other ethnicities. Number 4. Lifestyle factors. Lifestyle factors such as obesity, unhealthy diet, sedentary lifestyle, and smoking can also elevate the risk. Regular screenings can catch prostate cancer early, even before you have any symptoms. For males at higher risk, like those with a family history or older males, screenings are even more important for these people. It's like checking under the hood of your car regularly to catch any issues before they get serious. So, don't skip those checkups. It could save your life. Symptoms. Now let's talk about the signs that might mean something's up with your prostate. There are some signs you should be aware of. Number 1. Urinary issues. These include difficulties with urination, such as frequent urges to go, a weak stream, or the sensation of incomplete bladder emptying. Number 2. Erectile dysfunction. Difficulty achieving or maintaining an erection when desired, which can be frustrating and may indicate prostate-related issues. Number 3. Blood in urine or semen. If you notice blood in your urine or semen, it's important to seek medical attention as it is not a normal occurrence. Number 4. Bone pain, especially in your back, hips, or pelvis. Bone pain can be caused by different things, but combined with other symptoms, it could point to prostate problems. Now remember, if you're noticing any of these symptoms we just talked about, like trouble peeing, erectile dysfunction, blood in your urine or semen, or bone pain, it's really important to reach out to a healthcare professional. I know it might feel a bit scary or uncomfortable, but trust me, they've seen it all before, and they're there to help. These symptoms could mean lots of different things, including prostate cancer. But the good news is, the sooner you get checked out, the sooner you can get the right treatment, if needed. So don't wait. Take care of yourself and get in touch with your doctor. It's the smart thing to do. Part 2. Diagnosis and screening. Now let's talk about how doctors check for prostate cancer. There are a couple of tests they might use. Number 1. PSA test. This is a blood test that checks the levels of a protein called prostate-specific antigen, or PSA for short. High levels of PSA could be a sign of prostate cancer, but they could also mean other things, like an enlarged prostate or an infection. Number 2. Digital rectal examination, DRE. This is where the doctor puts on a glove and inserts a finger into your bottom to feel the prostate gland. I know it sounds a bit uncomfortable, but it's really quick and can give the doctor an idea if there are any lumps or abnormalities in the prostate. Number 3. Prostate biopsy. If your doctor finds something suspicious during the PSA test or DRE, they might recommend a prostate biopsy. During this procedure, small samples of tissue are taken from the prostate gland and examined under a microscope to look for cancer cells. These tests can help doctors figure out if there might be something going on with your prostate, but they're not perfect. Sometimes, they might suggest more tests to get a closer look. So, if your doctor recommends these tests, don't worry, they're just trying to make sure everything's okay. And remember, early detection can make a big difference in treating prostate cancer. If we catch it early, we have a much better chance of treating it successfully. That's where regular screenings come in. By getting checked out regularly, we can catch any potential issues before they have a chance to get serious. And the earlier we catch prostate cancer, the more treatment options we have and the better our chances of beating it. So it's important to stay on top of your health and get checked out if you have any concerns. Treatment options. Now let's explore the treatment options available for prostate cancer. Number 1. Active surveillance. This approach entails closely monitoring the cancer without immediate treatment. It's frequently advised for men with low-risk prostate cancer or those who are older and may have other health concerns. The doctor will regularly assess the cancer's progression and initiate treatment if necessary. Number 2. Surgery. Surgery, also known as prostatectomy, involves removing the prostate gland and, in some cases, nearby tissues. It's a common treatment option for prostate cancer, especially if the cancer hasn't spread beyond the prostate gland. Number 3. Radiation therapy. Radiation therapy uses high-energy rays to kill cancer cells. It can be delivered externally, external beam radiation, or internally, brachytherapy. Radiation therapy is often used as the primary treatment for prostate cancer or after surgery to kill any remaining cancer cells. Number 4. Hormone therapy, also called androgen deprivation therapy, works by lowering the levels of male hormones in the body, such as testosterone, which can fuel the growth of prostate cancer cells. It's often used in combination with other treatments to shrink the tumor or slow its growth. Number 5. Chemotherapy. Chemotherapy uses drugs to kill cancer cells or stop them from growing. It's usually reserved for advanced prostate cancer that has spread to other parts of the body. Chemotherapy may be used if other treatments haven't been successful or if the cancer has become resistant to hormone therapy. Number 6. Immunotherapy. This boosts the body's immune system to fight cancer cells. It's a newer treatment and is sometimes used in advanced cases. Each treatment option comes with its own set of pros and cons. When deciding on the most suitable treatment for prostate cancer, several factors should be taken into account. One significant consideration is the stage of the cancer, how extensively it has spread, Additionally, the grade of the cancer, indicating its aggressiveness, is important to consider. Another factor is the overall health of the individual and their ability to tolerate treatment. Lastly, patient preferences, including what they feel comfortable with and their desires for their treatment journey, play a crucial role. Therefore, making treatment decisions resembles assembling a puzzle, and it's essential to consult with healthcare professionals to develop the most appropriate treatment plan for each individual. Part 3. Prognosis and survival rates. Now let's talk about what happens next after someone is diagnosed with prostate cancer. This is called the prognosis, which is basically what we expect to happen. It's like looking into the future of cancer treatment. The prognosis depends on a few things, like how far the cancer has spread, the stage, and what kind of treatment is used. Generally, the earlier the cancer is caught, the better the prognosis. Over the years, doctors and scientists have been working hard to find better ways to treat prostate cancer. And you know what? They are making some really cool progress. Thanks to these advancements, survival rates for prostate cancer have been getting better and better. That means more and more people are living longer and healthier lives after being diagnosed with prostate cancer. It's like the medical world is scoring big wins against this tough opponent. So, while dealing with prostate cancer can still be challenging, it's important to remember that there's a lot of hope out there. With continued research and advancements, the future is looking brighter than ever. Prevention and lifestyle recommendations. Now, let's discuss some easy ways to lower the chances of getting prostate cancer. It's all about taking care of yourself, and here's how. Number 1. Maintain a healthy lifestyle. Eating a balanced diet like fruits, vegetables, and whole grains can help lower your risk of prostate cancer. Limiting red and processed meats, as well as saturated fats, is also necessary. Remember to stay hydrated and drink plenty of water. Number 2. Regular exercise. Get moving for at least 30 minutes most days of the week with activities like brisk walking or swimming. Not only does exercise benefit your overall health, but it can also reduce your risk of prostate cancer. Number 3. Skip the smoke. Smoking is not only linked to lung cancer, but can also increase the risk of developing other types of cancer, including prostate cancer. If you smoke, consider quitting, and avoid exposure to secondhand smoke whenever possible. Number 4. Know your risk. Certain factors, such as age, family history, and ethnicity, can increase your risk of prostate cancer. If you're at higher risk, talk to your doctor about early screening options, such as PSA tests and digital rectal exams. By making these simple changes, you're taking significant strides towards keeping your body healthy and lowering the risk of prostate cancer. It's all about giving yourself the best shot at a long and happy life. And always remember that your health matters. It's most important to take care of yourself, and one way to do that is by getting regular checkups with your doctor. So, don't hesitate to schedule regular checkups with your doctor to ensure everything is on track. Your future self will thank you for it. Conclusion. Now let's recap what we've learned today. We talked about what prostate cancer is and its symptoms. We discussed the importance of understanding risk factors and getting regular checkups. We covered treatment options and the importance of early detection. We also highlighted advancements in treatment and improving survival rates. And we offered tips for reducing the risk of developing prostate cancer. Remember, taking care of your health should always be a top priority. If you have any concerns or questions, don't hesitate to consult with your doctor. Your well-being matters most. If you're looking for more information or support, there are plenty of valuable resources available at your disposal. Take a moment to check out the links provided in the description for reputable websites like the National Cancer Institute and WebMD. These sites offer a wealth of information and support for individuals affected by prostate cancer. If you have any questions or comments about prostate cancer or anything else we talked about today, drop them in the comments below. We truly value your feedback and are here to provide answers and support. If you found the information in this video helpful and insightful, like and share it with your friends and family. And don't miss out on our upcoming health-related content by hitting the subscribe button below. We've got plenty more valuable insights and tips coming your way, so stay tuned. Before we go, thank you for watching and supporting prostate cancer awareness. Together, we can make a difference in spreading awareness and helping people take charge of their health. So, until next time, take care and stay healthy.